When I got involved, it was quite near the start of the war. So the Russians were advancing north of Kiev, obviously bombarding Kiev with rockets and artillery. And obviously this was a war potentially that could spread into the rest of Europe. So I wanted to see what I could do and what ways I could help.
I've been watching, like we all had, some of the clips on the television of the people and the victims of the war. I knew Leicester was interested in going out there, and that unfolded, and fortunately I was able to get involved with that as well. So Leicester went out and did the reconnaissance and a lot of the groundwork to make it possible for us to be in the place that was best suited for our skill set. And when Leicester and I crossed over, I relieved Leicester and we were to carry on the work from there.
I was in the military, in the army, back in 1995 to 2000. So I'd been places like Bosnia and Northern Ireland. So sort of kind of used to working in hostile environments. Bosnia, fairly similar-ish situation. Maybe not on the same scale, but so yeah, it's a long time ago.
I'm an ex-serviceman also, but I was a clearance diver in the Royal Navy, but I seemed to miss all the conflicts. I got to the Falklands too late and I got to the Gulf too early. So it wasn't something I'd experienced before, some other exposure.
But you had some urge to go, would that be right? Or?
As a paramedic, rather than a fighting person, it was a different skill that we had to offer, and we were both convinced that we had a lot to offer for their needs, being paramedics on frontline duties, dealing with trauma, and also more recently for both the pair of us, a more general medicine approach to delivery of care, which was also a need out there at that time.
I'm kind of prepared with our experience from the primary care side to minor injuries to major trauma. With our skill set, we had to prepare for all those scenarios and expect all those scenarios.
From Kiev, my first impression, it was just a normal city. It was being rocketed quite regularly, but the evidence of that was quite sparse. I didn't feel we could hear it, and the sirens were quite frequent, but I didn't feel at danger at all. I spent my first week or so, for weeks, 10 days in the north before travelling south, that was a little bit different. Very chaotic, disorganised. You're very much trying to sort things out yourself. There's not much guidance in this form as where to go and how to get there. You're just making things up as you go along, really, but you're taking the best advice as you can to try and keep you safe.
Once we transferred the ambulances from Lviv to Kiev and kitted them out like they were shells, we had lots of kit in boxes and stores, so we kitted them out like a UK ambulance would, so it could function as an ambulance. So when we first got to Kiev at the earlier part of the war, the Russians were still occupying north of Kiev. So the first night there, you could hear the rumblings, the rocket fire, kind of in the distance, I suppose about 12k or so away from the occupied areas. Soon after we got there, the Russians began to withdraw, and as they started to withdraw from the areas like Irpin, Bucha, Borodyanka, we then went to those areas, and a lot of those times we were the first non-government organisations in those areas. And there was a clear difference between Kiev, which was, like Richard said, mostly, apart from the roadblocks and the military checkpoints, there was a lot more of them to start with. It's kind of almost a quiet, normal city, but when you entered these areas, they were like post-apocalyptic type scenarios where just mass devastation, streets blown up, tanks, houses, and destruction. So, and it's probably different dangers because we were the first going in. They hadn't been cleared of mines, obviously unexploded ordnance. So that's probably more of the threat that we had to be aware of. Be careful, not standing on soft areas, make sure you're on hard ground. If you're entering buildings, just be aware there could be booby trapped, and not touching things you shouldn't be touching. So it's kind of a different, more of a situational awareness to danger. There's still remote chances of rocket attacks, but it is more of unexploded ordnance and things like that for us.
Cluster bombs were used quite prevalently throughout the war and still are. You need to be aware that a fin-shaped shiny thing sticking out the ground is likely to be a cluster bomb, and you're not to be fiddling with it.
As the Russians withdrew, we went to these villages. So there's a combination of things. Of a lot of the elderly could or wouldn't leave, and had been by then it had been 4 or 5 weeks of occupation, bombardment, constant shelling. So the mixture of chronic sort of medical conditions, where chronic infections in feet, even end-of-life patients, old shrapnel wounds. They just put a temporary dressing on, and they've got old shrapnel wounds that they developed. And there was also victims of brutality from Russian troops as well.
Many of them had nowhere to go. The elder generation don't have the same contacts that the younger generation have in different countries, and they don't feel they want to go, and why should they, in many ways. The work that Leicester started doing in the north was not quite so needed. By the time I'd got there, pharmacies had opened, and there'd been a bigger time span between the Russian occupation and civilian life coming back to normal. So we headed south to try and find areas that would be best suited. And we ended up for the last 2 to 3 weeks, I was working from a frontline hospital just north of Mariupol. So we had troops coming off the front line, and we were just supporting the Ukraine military have adopted various places, buildings, and turned them into treatment centres all along the front line in order to support the troops medically. And there was a real need for paramedic type work in these areas. So the medicine side of work had changed to more hands-on paramedic style of work.
In places like Biodank and Bucha, we'd often drive to an area, stop to give out humanitarian aid like food, and then someone would say, oh, someone in this house needs some help, and then you bounce along to another house, oh, someone over there needs some help. So a lot of it's spontaneous in those areas for me.
It was a lot of exposure in a short period of time. I've been a paramedic for 30 years, and I probably did more trauma in the few weeks I was there than I did in 30 years in this country. And it's a different type of trauma. As a paramedic, you see quite fresh injuries, and gunshot wounds and shrapnel wounds are very different. They're very dirty, they're very involving. Sometimes it's difficult to distinguish between a soldier's webbing and his organs and his tissue. It's quite a messy old business, and trying to clean, debride and prepare for surgery, which is what the frontline hospitals are doing. They're trying to stabilise and prepare these injured troops for further surgical intervention. Soldier had a piece of shrapnel come down through his shoulder, through his chest, punctured his lung, damaged his kidney, damaged his spleen, and rearranged his bowel. And we were operating on him in the hospital, and the only monitoring equipment we had was a finger probe SATS monitor that I took out with me, and a wrist-mounted blood pressure monitor that the nurse practitioner I was out there with was using. But you do what you can with what you've got sometimes, because you've got the volume of soldiers. They're coming in truckloads. You do nothing for half a day, and then all of a sudden it's just chaos, and you've got just bodies in the corridors as such being treated. It's quite chaotic.
When you're actively doing things, you have less time to think about things. It's probably in some ways worse as an onlooker, because you're not actually doing anything and you feel helpless, but you go through a process of treatment, whether it be managing hip bleeding, whether it be managing pain. So you're very much involved in the event at the time, so you don't really have much time to think. I don't know. My kids are old enough to watch telly, and the outside perception, the whole of Kiev's under bombardment, but really it was just the north mostly. So where I was, even though I was in Kiev, I didn't tell my kids until I'd been there a few days, and then I said, I've been there a few days, it's fine, don't watch the news. So this kind of and if we were going somewhere a little bit more dodgy, we'd probably tell them a little bit later. Until we got there and said, it's okay here. We're a little bit further west or east. A bit further south than I said.
I'm not sure whether it's a cultural thing, but the Ukraine drivers seem to be always in a hurry, and the roads aren't good, so they're busy dodging potholes, and the car coming the other way is busy dodging potholes, and it's a bit of a wacky race, is hit and miss as you come into contact. And I always felt that if I'm going to be injured out here, it's going to be on the roads.
That's why we drove ourselves a lot. So had some control over the situation at least, and
it was quite comforting, I felt, working in the back of a UK ambulance that I was very familiar with. I've spent hundreds of hours in the back of these things, and you feel quite at home in them.
Getting access sometimes can be difficult. So to administer fluids or blood products and medication, if they've been in major trauma, or they've been left a long time, or very cold, it can be very difficult anywhere to do that. And in the UK, we have different options like intraosseous access, where we give fluids straight into a bone by putting a needle into the bone, and being able to do that. And it's something very simple that could save lives. The training could be done very quickly, and that's something we feel would be very helpful. And we thought about how we could do that.
Unfortunately, a lot didn't survive the night, and the ones that did survive needed quite a lot of work. And I think intraosseous as a introduction would be something helpful over there, which isn't something they have at the present time.
Without the support of Kernow Health, it would have been a non-starter right from the beginning. So I was very thankful to Mark Walcock and the senior management team for seeing the bigger picture of the need in Ukraine, and how we can help. And I think particularly as a background of paramedics, primary care, urgent care, minor injuries, we've got such a good skill set to offer, and I recognise that, and we proved right. We were able to help in different ways in different areas, both from civilians, primary care type stuff, to trauma, right up to major trauma, the military casualties that obviously Rich was seeing.